The following segment is sponsored by Comprehensive Integrated Care. Today, we're taking a closer look at peripheral artery disease, otherwise known as PAD. Dr. Ryan O'Hara and Andrea Slack are here to explain this condition and how Comprehensive Integrated Care can help. Welcome back to the show, you guys. It's good to have you here.
Thank you.
So for those that don't know, myself included, what is PAD? What is that?
So PAD, or peripheral artery disease, it's kind of a tongue twister. Yeah. It's a progressive disease where there's some narrowing of the arteries in the legs and feet is what we're concerned with, where there's just some clogging, there's some plaque, and it causes some symptoms, some signs and symptoms that we want to treat. Gotcha.
And Dr. O'Hara, PAD, who does this affect?
Well, David, currently there's about 10 million adults in the U.S. with PAD, suffering from PAD.
Wow.
The global incidence is increasing about 25% since 2020.
Okay.
And that's mostly secondary to diabetes. About 11% of those will go on to develop a condition called chronic limb-threatening ischemia. And that's a medical condition where the blood flow to the lower extremities is not adequate enough to meet the resting metabolic needs of the tissues. So that leads to resting pain, tissue necrosis or ulcerations, gangrene. About a quarter of the patients suffering with CLI, chronic limb-threatening ischemia, will go on to major amputation within that year. And the scary thing is about that is that the 3-year mortality rate, or the number of people dying within 3 years, is 70 to 75%, and that's more than.
This is intense.
It's intense, yeah. It's more than most advanced cancers.
Wow. So what are some of the signs and symptoms that we should look out for?
Yeah. So pain at rest.
Okay.
Ulceration, particularly in diabetics, and those are the major ones for critical or chronic limb-threatening ischemia, and it's preventable.
It's preventable, so you can treat this. How is it treated?
So what we recommend is that diabetics maintain their blood sugar, usually with an A1C of less than 7 if possible.
Okay.
Get annual foot checks by their podiatrist or their primary physician. Maintain a healthy blood pressure and a healthy blood cholesterol.
Okay.
And then if they do have an ulceration, everybody should have an arteriogram to make sure that they have adequate blood flow to that extremity.
Sounds like you got all the answers. So how can Comprehensive Integrated Care help?
Yeah.
What do you think?
So we can do the diagnostic portion there in the center as well as the treatment. So it's kind of a one-stop shop. That's done by Dr. O'Hara. So we have a variety of procedures, and patients can work with their PCP, their provider, or they can just give us a call or go to the website.
Sounds like it's a big problem. You got big solutions for these. So where can we go for more information?
So our website is utahcic.com or ciccenters.com. And the phone number is going to pop up. I'm going to say it wrong probably, but 801-810-2999.
And we've got that on the screen for sure. We appreciate your time. Thank you for finding that solution to these problems. Thank you so much for being here on the show.
Thank you.
Thanks, you guys.